Welcome you here to CommonWell TV 2021, where we introduce you to some of our CommonWell Health Alliance members. And it's time now to talk with ADVault and their CEO and president, that being Scott Brown. And Scott, obviously the past 18 months has been challenging, not just for the health IT space, but everywhere. If you could maybe come up perhaps with maybe some benefits that have come out of the pandemic through health information technology.
Sure. At ADVault, we've always been focused on getting the patient's voice into the medical record. Doing that improves clinical decision making, it improves outcomes, it improves satisfaction for everyone involved, and it actually decreases costs associated with higher quality care. So before the pandemic, emergency care planning, advanced care planning, these were often pretty overcomplicated and sometimes they were neglected entirely. The pandemic showed everyone in healthcare that a person, a young, healthy person, could go from being generally healthy to being on a ventilator in 24 to 48 hours. So we had patients on ventilators that can't communicate with medical personnel. And the high transmissibility of COVID-19 has altered the way emergency rooms and hospitals have been operating. Family and loved ones weren't able to be in the room because of the patient due to contagion. Effectively, there was no one there to speak for the patient. And hospitals haven't been accepting paper documents, also because of fear of contagion or that the concerns that those documents will get lost. So we haven't had access to these kinds of documents. So all of a sudden, digital emergency care planning and digital advanced care planning has taken on a whole new sense of urgency. And the ability to create these types of documents digitally and to be able to share them across all points of care seamlessly and securely, it's really become critical to the provision of high value, high quality care. We believe the accelerated adoption of digital documents like advanced care plans, portable medical orders is going to continue even beyond the pandemic, especially in hospital systems. For example, I can think of an Accenture 2021 very recent survey where 58% of hospital respondents said patients expressed a preference for electronic documents over paper forms. So we're definitely seeing that preference affect decision making in our customers. And we believe that the pandemic, among other things, if we're looking for positives, has accelerated the migration to digital documents in general and to digital advanced care planning, advanced care plans, and portable medical orders in particular.
What else do you see on the horizon with health IT?
We're focused on two trends right now that we're seeing into the horizon. First, you have consumers who are demanding not only access to their healthcare data so that they can share it with their healthcare providers, they also want to be able to add documents and data to their medical record. There continue to be issues around provenance and calibration of remote monitoring devices like blood pressure cuffs and glucose monitors, but non-clinical documents created by patients, advanced care planning documents, mental health directives, birth plans, nutrition plans. These are all patient-generated documents and that the consumers and patients want into their medical record, and we see that push going further and further on the horizon. The second trend that we're seeing in health IT is actually focused on healthcare payers. Health plans, especially the Medicare Advantage plans that participate in the Center for Medicare and Medicaid Services or the Center for Medicare and Medicaid Innovations value-based insurance design models called VBID. CMI requires its VBID program it uses it as a testing ground for innovation. And anyone who's been tracking over the last few years that would notice an increased focus on providing advanced care planning service to Medicare beneficiaries. More importantly, the reporting of the metrics demonstrating the efforts and progress of that advanced care planning. The only way to do that effectively and comply with program requirements is to leverage health IT. And we're seeing health plans increasingly willing to do that, and even to encourage and incentivize providers in their network to use tools to facilitate creation and the seamless and secure sharing of these types of documents for their beneficiaries.
So the growth of CommonWell through the years has been exponential. What was one of maybe, or a couple of the real reasons why ADVault wanted to become a member?
ADVault joined CommonWell because we believe in CommonWell's mission, and we believe in the mission of CommonWell's members. We believe that healthcare providers and individuals should have access to health information for the people that they treat, wherever they need it, when they need it, where they need it, and regardless of where the prior care occurred or who provided that care. At ADVault, we take that interoperability mission a step further and believe that all healthcare providers should have access to the wishes and values of the people they're treating. Even if the patient in front of them is suffering a medical emergency and can't communicate with them to express those goals of care and their preferences and priorities with respect to certain medical interventions. And they shouldn't have to pay extra or to be forced to submit to a heavy-handed electronic health record platform vendor or an IT integration partner to access that critical information. So by partnering with CommonWell and members, and by leveraging things like the connectivity available through CommonWell, we're ensuring that providers at more than 85% of U.S. hospitals and long-term care facilities can query and retrieve advanced care planning documents and portable medical orders like POST and MOLST forms from our system, from our what we call our ADVault exchange, which is an interoperable registry and repository, for free. And I would capitalize all caps for free. No additional cost to them. They get to use the native functionality that already exists inside their electronic health record platforms. And that dramatically reduces the barriers that have prevented patients' values from being documented, located, retrieved, and considered as part of the clinical decision-making process. So we're very excited about what that means for all of the stakeholders in healthcare and what CommonWell does for all of those stakeholders. The doctors and nurses in hospitals that are treating people, folks in long-term home health and hospice care who are providing care to patients and really need to know something about the person that's in front of them, and even private health plans and the government programs like Medicare and Medicaid that are paying for those healthcare services. Most importantly, we believe that in the CommonWell mission and how it provides benefits to patients, to their caregivers, and to their loved ones. So we're one with that mission, and we have partners through CommonWell that we're working with to make sure that without that additional cost and without that additional effort and integration, they're able to access everything that's in our registry and repository for free at no cost to them.
The president and CEO of ADVault, Scott Brown. And for more information on ADVault, along with CommonWell, we invite you to log on to CommonWellAlliance.org. Thanks so much, Scott.
Thank you all. Have a great day.
Thanks for watching this episode of CommonWell TV. To get the latest news and updates, follow CommonWell on Twitter. We also encourage you to subscribe to our CommonWell YouTube channel and hit the bell icon to receive notifications when a new episode is posted.